Welcome back to Face the Nation. As some parents prepare to send their kids off to camp this summer, the CDC revised its COVID guidelines for children, particularly those who have been vaccinated. One of the largest providers of day and overnight camps is the Ymca of the USA. And joining us now from Philadelphia is its president and CEO, Kevin Washington. Good morning, Mr. Washington.
Good morning. Glad to be here this morning.
We're glad to have you. So last year, summer camps were significantly curtailed as a result of the pandemic. Now the CDC has come out with this guidance. What do things look like this year? Is camp back?
Well, we know it is, and we're hopeful that it will be an exciting summer for young people. We know that they experienced significant difficulties over the past year, with school being virtual, isolation, away from their friends. We're happy with the CDC guidelines that they put forth, and we know that the Ymca of the USA and all of our affiliates will operate camp for fun and safety with all of the CDC guidelines in mind. We learned a lot last year when the pandemic was in place. Some of our camps did run. And because of the partnership we had with the CDC and the American Camping Association, we feel very confident about being able to put forth a summer where kids will have fun, enjoy themselves, have some learnings, meet some new friends, and be engaged in what I would call a summer of fun for our young folks who really, really needed this summer. It will help their emotional, social, and physical activities that they're looking for this year.
As I understand it, there are 10,000 day camps and 230 overnight camps. When the CDC issues this kind of guidelines, how easy is it, or what's the process for taking that information and making sure it's in place and the new guidelines are working for parents who have kids attending that many camps?
Well, one of the things we make sure that it's important, as you know, that there are local and health guidelines that are available that the YMCA has to work by in each state. We have YMCAs in every state, as you know, and 50 of those states have said, yes, you can open your camp this year, but each of them individually, locally, have restrictions that we have to abide by. So all of our camps are engaged in this work, ensuring that they're providing a safe environment and following local and state health officials as well as CDC guidelines. And that's the way that we work this process, using all of that information to provide the kind of environment where parents can feel comfortable that their kids have a safe environment to do what we do at camp. One of the other issues that's extremely important is, as we have the vaccine has rolled out, as you know, that the emphasis was on teachers, childcare workers, and camp counselors. So a lot of our camp counselors had the opportunity to get a prioritization to get vaccination as part of this process as well, ensuring another level of safety for our kids as they attend camp this summer.
And they had access to the vaccine, those who work in the camps, but will it be mandatory if somebody is teaching in the camps over the summer that they be vaccinated?
It has not been mandated, but we know that so many of our camp counselors have taken advantage of the opportunity, but it has not been mandated as of yet.
And why did you decide not to mandate it? Tell me about that process as you thought through it.
Well, as a national resource organization, we cannot mandate, and as you know, there's been quite a few issues around that particular area, so we cannot mandate at the national resource. We have to make sure that YMCAs follow state and local guidelines, and many Ys are following what school districts are doing in their communities as well as a guide in this process. So we cannot mandate because each YMCA is an independent organization, 501c3, and have to follow local and state health guidelines. And so they are different in every state that in the country. So we cannot mandate that.
30% of the campers attend with some kind of financial aid. How has the pandemic changed that picture in terms of those who need financial aid to enjoy these camps?
Great question. For us, access and equity is a key component of who we are. We want to ensure that all kids have the opportunity to attend our camp. So during the pandemic and beyond that, because we know that kids of color and kids in marginalized communities have been affected disproportionately by COVID-19, we're making extremely strong efforts to ensure that we have the resources available to support them as they come to camp. we ask all families, if they're interested in going to camp, contact your local YMCA camp, because we do have funds available at the local level to ensure that we're providing access to those young kids. You know, I know, and many of our kids know, and parents know how transformational a summer camp experience can be. And we want all kids to benefit from that, to provide that kind of opportunity where they can meet new friends, develop new skill sets, and become engaged in our lifelong relationships with others. So we want to make that available. Access and equity is a key component of who we are as an organization, and we do all that we can to raise funds to support those families who may not have the ability to afford camp.
You talked about the disparities that have been laid bare as a result or highlighted by COVID-19. I was struck by how much the Y has adapted over the last year and a half, providing emergency meals, taking care of children of first responders, becoming a homeless shelter. How much did the YMCA of the USA have to change and pivot as a result of the pandemic?
Great question. You highlighted some of the things that we do, but you know, as an organization, we've been around for 170 years. So we've been always able to respond to the needs of our communities. The pandemic was another example of how we were able to pivot and I say become what I would call a vital community asset in the communities that we served. 1,400 childcare sites that we put up to ensure that first responders, police officers, and others who were on the front line could have a place for their kids to go and be safely engaged in that as they did their jobs. 1,300 feeding sites, because we knew we feed kids during the course of the year, but recognized that that need grew bigger with families and other communities. So YMCA stepped up to provide that. All of those things were important and demonstrated that we can be a vital community asset. And as you know, we lost substantial revenue through this process, but was able to pivot and provide our communities with what they needed from us. And we continue to do that on a daily basis.
And you'll continue to do that this summer. Camp is back. Kevin Washington, thank you so much for being with us. And we'll be back in a moment. As more Americans get vaccinated, they're hitting the roads, riding trains, and taking off in planes to get away. For more on how the industry is preparing for a travel surge, we go now to the CEO of TripAdvisor, Stephen Coffer, who joins us from Newton, Massachusetts. Good morning.
Good morning to you all.
So many people remember where they were at the beginning of this pandemic because they had to cancel travel plans. Now, with vaccinations up, what does the picture look like?
Travel is back. If you look at the U.S., this is going to be a really busy season, we see. Half the people in America want to take a summer vacation and domestically, another quarter want to take an international trip. And so if you think back to a year ago, it was concern, it was cancellations, and those taking trips were going outdoors. Now we have a lot more activity all around the country, and it's not just outdoors. The cities are making a very real comeback.
And as you look at what people are looking for, are they, you mentioned outdoors, going back into the cities, which had high caseloads. Are you noticing behavior changes from what we would have expected in a pre-pandemic age?
Yes, in fact, we're seeing people interested in taking slightly longer vacations, spending more. 40% of folks say they're going to be spending more on this vacation. What are they going to do? They're going to take a longer vacation. They're going to do a few more things on the vacation. They're still not going internationally as much as they might have in 2019. They're just not sure yet how much is open, especially in Europe. But we expect that to increase over the course of the summer. And bottom line, they're getting out and everyone's going somewhere this summer.
Can the system handle it? Airlines, hotels, all of the institutions that have been challenged, can they handle this new glut of people wanting to get out there?
I think if travelers approach it with some patience, because I think airports will still have a bit of lines. I think flights will be quite full. I know airlines are ramping up capacity as much as they can, especially domestically. So yes, I think everyone's going to be able to have a great summer vacation no matter where they're going.
You mentioned the word patience. There have been a number of incidents where people aren't showing any kind of patience at all, hitting flight attendants. 2 airlines have now decided they're not going to be serving alcohol on flights. What do you make of that?
I think there is a tremendous pent-up demand. Of course, we encourage everyone to remember why you're going on vacation, to have a great time, to be relaxed, to visit family and friends, and the minor inconveniences to get there. It's just part of the travel. Remember why you're going on that vacation.
Have you seen, you mentioned the minor inconveniences, the people who traveled before the vaccines were available, certain places had restrictions in terms of mask wearing, congregating, how many could be in your party. Do you see people making choices based on those kinds of things, which even if they're not in place anymore, were kind of cultural signals? Do you see people making choices based on kind of where they can go in the country and feel free from the cultural restrictions that were part of the pandemic?
I'm not so sure on the cultural restrictions versus the pandemic introduced a lot of us to more outdoor activities. And we do see that continuing this summer. I believe I read the national parks still say there so many of them are booked up for camping throughout the summer. And so as people go out and explore, as they look to have the great time, I mean, on TripAdvisor, we see hotel searches up, we see all the different experiences that you can book on TripAdvisor. Those are really going quite strong, again, demonstrating that that strong return to travel this summer.
Let's talk about a couple of specific kinds of travel. Let's start with cruise ships. Those played an important role in the pandemic, obviously. What's the status of the cruise ship industry?
Well, as you may know, you can now cruise to Alaska. There are cruise ships that are going to be coming online, taking cruises. The cruise industry, if you've taken a cruise, chances are you love taking a cruise. Very, very loyal. People are coming back. They report quite strong advance bookings. So whether it be a cruise, a flight, or a hotel, if you're looking to go somewhere this summer, better start planning.
What about vaccine passports for some of this kind of travel? What should people think about that? And how much are businesses weighing that from a business standpoint?
You know, a lot of countries very naturally, now we're talking international travel, very naturally want to make sure that their populations are protected. And many, I believe, will be adopting some form of a vaccine passport so that travelers from other countries won't have to quarantine. That would ruin any vacation. So get your vaccine if you're in this country and you want to go abroad. That's going to be essentially your passport to landing and getting on with a remarkable trip. We hope that many countries adopt the same type of vaccine passport so it becomes relatively easy, whether you're going to France or Germany or Italy or the UK, that you'd be able to show the same form of passport and get in easily.
I want to ask you about foreign travel in a moment, but I wonder, are any businesses, even in the United States, making business decisions based on the vaccinated? In other words, are they looking at the kinds of people who've been vaccinated and either marketing to them or making a judgment about the kinds of vacations the people who are vaccinated would take versus those who are not?
I'm not sure about that, but I have spoken with a number of small businesses that hope that more and more people all around the world will become vaccinated and therefore travel to the US, because the US loves the tourist dollars from all over the world. And to make sure our borders are open, vaccine passport is a great way to come in and not quarantine.
In the last 30 seconds, the State Department has level 4 restrictions on so many foreign countries, almost 80% at one point. How do you think that will change, and how's that affecting the travel business?
It has been affecting the travel business massively in terms of how many people can take those international trips. We would really appreciate all governments getting together or acting on their own to allow foreigners to come into their country with a vaccination passport or a set of tests, depending on their choice, just to encourage more and more cross-border trips, vacations, and of course, experiencing the whole world.
All right, Stephen Coffer, thank you so much for being with us. We have to travel to a commercial, and we'll be right back. The coronavirus pandemic has fueled a mental health crisis in the United States, and we go now to Paul Gionfriddo. He is the president and CEO of Mental Health America. He joins us from Middleton, Connecticut. Good morning.
Good morning.
Today, Mental Health America will release survey data that has never been collected in this way before. Can you explain to us why this survey data is so important?
Yeah, and on a rainy day here in Connecticut, I hate to be the one dampening the optimistic tone of this show so far, but we don't gather mental health data, mental health impact data in real time. We never really have in the country. And for the most part, we've had to wait a year or two after a crisis has occurred to try to assess the mental health effect. We at Mental Health America, though, have been gathering in real time mental health screening data over the course of the last several years. And the report today focuses on 750,000 health seekers who took a mental health screen with Mental Health America this last year during the course of the pandemic and give us a real time understanding about how the pandemic's affected them.
And why is it so important to have a real-time view, and how different is that from normally what we are able to do to collect data on those who are facing mental health challenges?
Yeah, if you want to wait for 2 or 3 years to figure out what happened before you begin to develop policies, practices, and programs to address those crises, then you don't need real-time data. But if you really want to get acting locally, state, and federally as quickly as you can to address mental health needs or any other needs, you really have to be looking at them in real time.
And you know, in your opening remarks, you talked about a difference between the kind of happy days are here again and the important, unseen in some cases, struggles people have with mental health. But that, in a way, has been the story of this entire pandemic. There has been the big story about hospitals with patients suffering from COVID-19, but underneath it has been a serious and growing series of challenges for people with mental health. So can you, or serious mental health challenges, can you just help us understand the landscape of what over the last year and a half we've been through as a country, and what the data tells us about the challenges on the mental health front that we've been facing?
Yeah, sure. The mental health wave of this pandemic has been like a second wave to the physical health wave of the pandemic. And what we've seen is dramatically increasing numbers of people, particularly young people, 11 to 17-year-olds, who have been taking mental health screens and have been experiencing mental health problems. One data point, for example, is that more than a third of people across all age groups who come seeking help to Mental Health America have said they're experiencing frequent thoughts of suicide or self-harm more than half the days of the week. That's 1/3 of a health-seeking population. It's more than 1/2 among our kids.
And while it's been a second wave and maybe not gotten as much attention, do you think that because this has been a pandemic that everybody has experienced, and many people have experienced a mental health component of it, that we as a country are more, that we recognize mental health challenges to our lives in a way we would not have before?
Yeah, I think we're recognizing them more because half of us would have had a diagnosable mental health condition, most typically depression or anxiety over the course of last year. Whether or not we're going to do something about that is really the question. It's easy to say that we're now getting more attention, and we are. Policymakers, public officials, community leaders are all focusing more than ever before on the mental health side of this pandemic. But what we're hoping to do with the report that we released today with Lundbeck is to try to take this to the state and local level and give state and local leaders an opportunity to do something with this information for our kids, for our families, and for our communities.
And you mentioned do something quickly instead of waiting for the time to lag in which you can't move quickly. Is there something about technology and the screening that you've been talking about that actually across the board or in the future will help create programs that assess mental health in real time so that we can get at this instead of having people suffer in silence?
Yeah, think about this. We've got 15,000 people each and every day coming and taking a mental health screen at Mental Health America's website. 15,000 people a day telling us what they need and giving us an opportunity to figure out how the trauma is affecting them, how depression is affecting them, what their suicidal thinking is, even serious areas like psychosis. And so the key thing is to be able to take advantage of what people are telling us to develop a system of care services and supports that actually answers the needs of people and not just addresses the needs as identified by advocates like me or service providers who have been out there from the beginning, because we need to rebuild this mental health delivery system if we're going to support everybody, including our kids, all the way up to people in my age group.
You said that you wrote recently that kids are returning to school broken. What did you mean by that?
Yeah, well, think about this. Before the pandemic, even before the pandemic, only about one child in every 30 who would have been, by NIMH definition, in need of mental health services by the time they were 18 were being identified for special education purposes to get those services, even though they were critical to their education. Those kids are coming back to school still without services. But in addition to them, so are the rest of our students. The children who have been at home for the last year, the children who've had their lives ripped from them, the lives that they knew were coming back. And in addition to that, our teachers and staff need some support as well. So when we say they're coming back broken, it's not that we can't do something about it. All kids need mental health services, and those kids with severe issues need support, as do their teachers. But the truth is, they're not getting it yet.
Well, and hopefully after this discussion, they will get more of it. Paul Gionfriddo, thank you so much for being with us, and we'll be back in a moment. Before we leave today, we want to thank a longtime member of the Face the Nation family for her service. Pat Coney is retiring from CBS after almost 30 years in the Washington Bureau. Pat served in the Navy during Vietnam, then began her career in journalism at the Army-Navy Times. She worked at NBC before moving to CBS in 1994. Pat kept all of us on our toes here at Face the Nation. That is certainly true of this wayward correspondent. We will miss her and her devotion to the broadcast and to the people behind the cameras, as well as those in front of it. And that laugh of hers, which for so long filled up our hallways. Thank you, Pat. I, along with everyone else here at Face the Nation, wish you a happy retirement. Thank you for watching Face the Nation. Next Sunday, we'll be talking with former Secretary of State Condoleezza Rice. Until then, I'm John Dickerson for Face the Nation.